New Orleans, Louisiana, March 12th, 1851. Dr. Samuel Cartwright rises before the Louisiana Medical Association. He has found a new disease, he tells the room. He calls it Drapetomania. Its only diagnostic symptom. The patient runs away. No fever, no lesion, no wound to examine. Just the act of leaving. The room does not laugh. The room takes notes. Cartwright is 57, a professor, the author of more than 80 medical papers. Tonight, none of that expertise is in question. Only his conclusion. No one in the room raises a hand to object. This is his case file. By 1851, well over 3 million people are enslaved across the American South. Escape is common enough that newspapers run entire columns of nothing else. Runaway notices, physical descriptions, rewards for return. A year earlier, the Fugitive Slave Act turned escape into a national crime. Law enforcement in free states is now required to capture and return anyone accused of fleeing bondage, whether they ever reach free soil or not. Cartwright is not a fringe figure. He holds a professorship at the University of Louisiana, now Tulane, in a subject built specifically around Black Americans, with its own name and its own faculty chair. The Louisiana Medical Association commissioned this exact report. They wanted a scientific accounting of what made enslaved people different. What he delivers is something else. 2 new diagnoses. One for people who run, one for people who resist. He titles the document a report on the diseases and physical peculiarities of Black Americans, framed as a race apart. Within weeks, it will be published in the New Orleans Medical and Surgical Journal, a respected, peer-reviewed publication. Neither diagnosis has ever appeared in a medical textbook before tonight. Cartwright was born in Virginia in 1793. By the 1820s, he had built a medical practice in Natchez, Mississippi, then across Louisiana, treating enslaved and free patients on plantations and in townhouses alike. He published widely: yellow fever, cholera, diphtheria. By 1851, he has authored more than 80 papers. He is, by the standards of his profession and his region, a serious man. His new report opens with a premise, stated as settled fact. Slavery is a natural, divinely ordained condition for Black Americans. Under this premise, a contented person would never wish to leave it. So when an enslaved person runs, Cartwright reasons, something in them must be broken. Not their circumstances, their mind. Cartwright is explicit about where this premise comes from. He calls the relationship between master and slave not based upon human, but divine law, citing the biblical curse on Canaan, condemned in Genesis to be a servant of servants to his brothers. If God assigned the role, in Cartwright's reasoning, then obedience is simply the natural order of things. Resistance to it is not a grievance, it is a malfunction. He names the condition Drapetomania, from the Greek drapetes, a runaway, and mania, madness. The word is new. The behaviour it describes is centuries old, its single diagnostic symptom, absconding from service. No physical exam is required. The overseer's report is the exam. Prevention, in Cartwright's model, starts long before anyone runs. He claims firm, consistent discipline rarely loses a master or slave to flight. Those who are too harsh or too familiar, which he calls, in his own words, treating slaves as equals, lose far more. The cure, in other words, is not cruelty and not kindness. It is management, precisely calibrated. Cartwright does not stop there. In the same paper, he describes a second condition, dysesthesia ethiopica. Its symptoms, he writes, sluggishness, a claimed numbness to pain, disinterest in labour. He adds one more, lesions on the skin, which he says are always present in a true case. Overseers already have a word for this. They call it rascality. Cartwright renames it a disease of body and mind together, one he says requires medical correction. For this second condition, his prescribed cure is physical. Wash the skin with warm water and soap, he writes. Oil it, then work the oil into the skin with a broad leather strap. Then, put the patient to hard labour in direct sunlight. Afterward, Cartwright claims, the patient will look grateful and thankful to the white man, whose compulsory power restored his senses and cleared the fog from his mind. The diagnosis required lesions on the skin to confirm it. The prescribed treatment was a leather strap. The marks that proved the disease could just as easily have been the marks the cure left behind. For early cases of drapetomania, sulkiness, quiet dissatisfaction, before a person actually leaves, Cartwright recommends a preventative measure. In his own words, quoted directly from the record, whipping the devil out of them. For those who flee and are recaptured repeatedly, one account from the period describes a further, more severe measure, removal of the toes, intended to make running physically difficult. Cartwright does not perform these procedures himself in the surviving record. He supplies the diagnosis. Others supply the enforcement. The paper is published in May 1851 in the New Orleans Medical and Surgical Journal, the exact publication that commissioned it. It runs without clinical challenge from a single colleague. Within the year, DeBow's Review, a widely read Southern commercial magazine, not a medical one, reprints the most quotable sections. The diagnosis now reaches plantation owners directly, without a physician in between. In the South, it is treated as settled science. In the North, it lands differently. In 1855, the Buffalo Medical Journal publishes a full satirical rebuttal, mocking Cartwright's logic line by line. Proof that even in 1851, some in American medicine recognized the argument as absurd on its face. No formal retraction follows. No medical body revokes Cartwright's professorship or his standing. The Louisiana Medical Association that commissioned the report never withdraws its endorsement. Cartwright continues practicing, publishing, and teaching in Louisiana for over a decade after the paper's release. Cartwright is already a known figure before this paper. He has treated and published on the yellow fever outbreaks in New Orleans. He rejects germ theory throughout his career, favoring older ideas about climate and constitution instead. None of that history makes drapetomania an aberration in his body of work. It is consistent with it, a physician confident enough in his own authority to name conditions that fit no prior medical category and to expect his profession to accept them. The report describes a third symptom, set for advanced drapetomania, a person who has already run once, been recaptured, and shows what Cartwright calls a sullen, dissatisfied manner beforehand. He frames this as an early warning stage, treatable if caught in time. The treatment, again, is punishment reframed as medicine. The overseer becomes the physician's proxy. The whip becomes a prescribed intervention rather than a disciplinary tool. Cartwright is not practicing psychiatry because psychiatry as a formal discipline does not yet exist. He is working within alienism, the study of the mind in mid-19th century medicine, a field then building new named conditions directly from disapproved behaviour. This is the same era that produces kleptomania, theft recast as illness, and pyromania, arson recast as illness. Cartwright borrows the identical structure. Take a behaviour a society disapproves of, attach the suffix mania, and call it medicine. Kleptomania and pyromania would go on to be independently studied and clinically documented for over a century. Drapetomania never was. The circularity is the entire mechanism. In Cartwright's framing, slavery is simply assumed, in advance, without evidence. to be beneficial to the enslaved. Anyone who resists that supposed benefit must therefore be unwell, because a rational person would not resist something believed to be good for them. The conclusion is built into the premise before a single patient is ever examined. This is why drapetomania requires no physical evidence, no fever, no lesion, no wound. Its only diagnostic tool is a behaviour a plantation owner already disapproved of, restated in Latin. The mechanism that lets this pass as medicine is institutional, not personal. A state medical association commissions the study. A peer-reviewed journal by 1851 standards publishes it. A university employs Cartwright to teach the subject formally, giving the diagnosis a classroom and a syllabus. Each layer lends credibility to the one beneath it. By the time a plantation owner reads the summary in DeBow's review, the idea arrives pre-approved by a professor, a journal, and a medical association. No single reader in that chain has to personally verify the underlying claim. Each is relying on the credibility of the institution before it. This is how a diagnosis built on zero clinical examinations becomes, for over a decade, treated as established Southern medical fact. This is not unique to Cartwright's era or to this one diagnosis. Around the same decades, physicians elsewhere are describing hysteria, a catch-all condition applied almost exclusively to women who did not conform to expected behaviour, also requiring no consistent physical evidence. The pattern repeats whenever a diagnosis is convenient for the people writing it. A behaviour a system depends on suppressing gets a Latin name, a symptom list built after the conclusion, and a physician willing to sign it. Drapetomania never crosses into mainstream American psychiatry. The American Journal of Insanity, the era's principal psychiatric publication, does not cite it once in the decade following Cartwright's paper. Outside the South, and outside Cartwright's own citations, the term is barely used again for over a century. Cartwright dies on May 2nd, 1863, in Jackson, Mississippi. The war that will end slavery is not yet over. He does not live to see its end. No institution, not the Medical Association, not the university, not the journal that published him, issues a retraction in his lifetime or after it. Slavery's abolition in 1865 makes the diagnosis obsolete. It is not disproven. It simply has no subjects left to describe. DeBow's Review, the magazine that carried the diagnosis to a lay readership in 1851, keeps publishing for decades afterward. Through the War, a wartime suspension, and a post-war relaunch. Closing only in 1884, more than 3 decades after Cartwright's report first ran in its pages. At no point across those decades does the magazine revisit or correct the claim. It is simply never brought up again. For over a century, drapetomania nearly disappears from medical writing altogether. Then, in 1971, a psychiatrist named Thomas Sayce brings the word back, not to use it, but to hold it up as an example. His point, that medicine had always been able to take disobedience and rename it a disease. Since then, the term has become shorthand in medical ethics for exactly that, a diagnosis written to serve the people writing it. Cartwright never examined a single patient for the disease he named. He didn't need to. The diagnosis was the desire to be free. One question for the comments. If a diagnosis needs no physical evidence, is it still medicine? The next case on this channel, 1889, a flu that crossed Europe by railway in weeks, not years. The first pandemic the modern world ever watched happen in real time. Subscribe, and the next file opens for you first. This is the sealed ward.